good morning, good afternoon, whatever. My name is Sarachapon Kosiwong, and today I'm going to do a presentation about the topic of impact of personalized medicine in health, society, and genetic relationship. My topic is calf lip, calf palate, and oral diseases. So please enjoy my presentation. Thank you. What is personalized medicine? Personalized medicine is a medical model that separates people into different groups, with medical decisions, practices, interventions, and or products being tailored to the individual patient based on their predicted response or risk of disease. In the picture below, showing the personalized medicine, prevention, diagnosis, treatment. Combine them together, that's what is called personalized medicine. Impact of personalized medicine in health, society, and genetic relationship. First one, the potential to tailor therapy with the best response and highest safety margin to ensure the better patient care. Second one, improving a patient's understanding of the serious side effects. The third one, how to respond to the treatment at both the populations and individual levels. And last one, reducing health disparities and improving health outcome for the species. So, if doctors know your genes, they can predict drug response and incorporate this information into the medical decision they make. So, if doctors know your genes, they can predict calf lip and calf palate. The picture in the left side showing the calf palate, which is the opening in roof of mouth, and the right side showing calf palate and lip, opening in both lip and in roof of mouth, which is more severe. What is calf lip and calf palate? Curves of the lip and or palate, CLP, are common birth defects of complex etiology. CLP can occur in isolation or as part of a broad range of chromosomal, Mendelian, or teratogenic syndromes, although there has been more progress in identifying genetic and environmental triggers for syndromic CLP. The etiology of the more common non-syndromic isolated forms remain poorly characterized. Recently, using a combination of epidemiology, genome-wide association studies, and analysis of animal models, several distinct genetic and environmental risk factors have been identified and confirmed for non-syndromic CLP. In the picture of the left side corner, showing the normal lips, and then next to the normal lips is the unilateral cleft lip and palate incomplete. Unilateral means one, so it's cleft only one side. Then the bilateral, so cleft two side, and the unilateral incomplete, so like it's all incomplete. And the picture below showing the occlusal view of your mouth, the normal palate, the cleft lip, the bilateral means two cleft lip, and then the cleft palate. Unilateral cleft palate one side, and then the bilateral also two sides. Epidemiology. CLP affects approximately 1/700 live births, with wide variability across geographic origin, racial, and ethnic groups, as well as environmental exposure and socio-economic status. In general, Asian and American population have the highest report birth prevalence rates, often as high as 1/500. The frequency of CLP also differs by sex and raciality. There is a 2:1 male to female ratio for cleft involving the lips, and approximately a 1:2 male to female ratio for clefts of the palate only. And there is a 2:1 ratio of left to right side clefts among unilateral cleft lip cases. Approximately 70% of all cases of CLP and 50% of cases of cleft palate only are considered to be non-syndromic. The remaining cases are composed of a wide range of malformation syndromes, including over 500 Mendelian syndromes, as well as those arising secondary to chromosomal or teratogenic effects. These syndromic forms are somewhat more tractable to genetic analysis. Diagnosis. In most cases, a prenatal ultrasound can detect cleft lip alone or cleft lip and cleft palate as early as 16 weeks into a pregnancy. The diagnosis is then confirmed at birth with a detailed visual assessment and physical examination. In some cases of incomplete cleft lip, the diagnosis cannot be seen on ultrasound. Cleft palate can occur alone without cleft lip. This type of cleft may not shown on ultrasound and may be a diagnosis for the first time at birth. At that point, a clinician will perform a comprehensive exam to identify the exact nature of the problem and determine whether the cleft involves the hard and soft palate or the soft palate only. In a small number of cases, cleft palate is a diagnosis on a fetal MRI performed for other reasons, such as a smaller jaw. Infrequently, a minor case of cleft soft palate will not even be seen at birth and will become noticeable later when the infant experiences difficulty feeding. For the candidate genes, the picture below showing the name of the candidate genes that involve in cleft lip and cleft palate. But the best current evidence has been reported for mutations in MSX1, FGFR1 fibroblast growth factor receptor 1, FGF8 fibroblast growth factor 8, and BPM4 bone morphogenetic protein 4. What is genome-wide association study, GWAS? In genomics, a genome-wide association study, also known as GWAS, is an observation study of a genome-wide set of genetic variants in a different individuals to see if any variant is associated with a trait. How genome-wide association study related with CLP? As is now apparent for many common complex disorders, GWAS has provided recent major advances in our understanding of genes and pathways that play a role in the etiology of CLP. Nowadays, GWAS for CLP using the case control design and one case parent trial study confirm that the impact of IIF interferon 6, which has previously been identified in candidate genes, study and discovered a new region of chromosome 8q24 that gave extremely strong evidence of association in the case control. Furthermore, confirmed that this gene desert region on chromosome 8q24 was strongly associated with CLP and identified additional loci at chromosomes 10q25, VAX1, ventral anterior home box 1, and 17q22 NOG knocking that achieved genome-wide significance. In the picture showing the loci 8q24, which is the site where the mutation occur, which you can see the chromosomal translocation, viral integration, chromosomal deletion, and amplification 1 and amplification 2, which cause the CLP. For the risk factors of CLP, firstly, family history. Cleft lips more likely to be inherited than cleft palate. Race more common in Native American, Hispanic, and Asian patients. Sex. Males 2 times as likely to have cleft lip, females 2 times as likely to have cleft palate. Environmental factors, exposure of fetus to alcohol, cigarette smoke, or drugs. And maternal nutrition, deficiency of folate. For treatment of cleft lip and cleft palate, lip repair surgery. Lip repair surgery is usually done when your baby is around 3 months old. So in the picture below, you can see that your baby got like cleft lip, and then the surgery can treat. So that baby looks normal. Palate repair surgery. Palate repair surgery is usually done when your baby is 6 to 12 months old. So before, you can see the hole, the infusion of the palate on your upper soft and hard palate, and then in the after doing the palate repair surgery, your palate is like fused together, so it looks normal. Dental care. Orthodontic treatment which helps improve the alignment and appearance of teeth may also be required. This can include braces or other dental appliances to help straighten the teeth. So you can see prior to bone grafting and then after meeting the orthodontist by using braces, the successful mixed dentition bone graft and orthodontic cleft dental gap closure, and then after treatment no braces anymore, so it's look normal. Speech and language therapy. A speech and language therapist (SLT) will assess of your child's speech several times as they get older. So for the prevention of cleft lip and cleft palate, preconception and prenatal care. Folic acid is a vitamin B that is thought to play a role in the development of fetal brain and spinal cord, especially during the first trimester of pregnancy. Folic acid, in fact, is needed even before a woman is aware of her pregnancy. Smoking and passive exposure. Pregnant mothers are advised to avoid smoking and passive exposure to smoke during pregnancy. They are advised a healthy lifestyle and avoid smoking and drinking alcohol. Anti-seizure drugs and cleft lip palate. Pregnant mother with epilepsy needs to anti-seizure drugs. These also raise the risk of cleft lip and palate. Combining two or more anticonvulsant increases the risk even more. Under medical supervision, it may be possible to reduce the number of medicine and the risk. Epigenetic biomarkers are showing some success and predictive tools, and it is possible that such tools may be useful in predicting or classifying cleft lip and palate or downstream consequences of cleft lip palate. For example, if a biomarker can be measured in an accessible tissue such as amniotic fluid, maternal blood, or chronic venous blood, it might be a useful tool for antenatal diagnosis or classification of CLP. Additionally, if measured at birth or early childhood, a biomarker might be useful in predicting surgical success, likelihood of scarring, or long-term health outcomes, thus identifying groups of patients who might benefit from extra monitoring. Other oral diseases, ankylosing, usually short, thick lingual frenulum, a membrane connecting underside of the tongue to the floor of the mouth. Congenital oral anomalies decrease the mobility of the tongue, may or may not associated with other orofacial anomalies. Ankylosing with cleft palate can be occur. For the gene mutation of ankylosing is ankylosing with cleft palate, semi-dominant egg-link disorder, and TBX22 mutation. TBX22 play a role in early vertebrate development, especially in mesoderm specification. Treatment and complication of ankylosing treatment. Frenotomy can be done without anesthesia. Frenotomy is like frenulum, like repair your frenulum, yeah. Cut off your frenulum. Procedure, hold tongue up and cut the frenulum, and then complication is bleeding. Thank you for being such an attentive audience. Thank you.